Hello friends, I am Dr. Mayur Modasia. I am a physician and I practice at Care and Cure Hospital, Daman. Heart failure. Heart failure, so when we use the term heart failure, it doesn't mean that the heart has failed. It means that the heart is functioning less and it can be of various intensity. It cannot be just one thing that the heart has failed. It is not like a pass or fail or on and off switch. So heart failure has various categories and various severities, and dealing with heart failure will require various modalities of treatment. It just means one simple thing, that heart is not functioning as much as it should function according to a normal person. Yes, it is not very uncommon in India. You can say that almost 1 to 2% of the Indian population is suffering from heart failure. Heart failure has various etiologies. Etiologies in the sense that it can have various causes. It can be because of blood pressure, it can be high blood pressure, it can be because of uncontrolled diabetes. It can also be from congenital heart disease. Congenital in the sense it means that it comes into babies who are born with some heart defects. But in our country, it is most common is blood pressure, diabetes, alcohol intake, and heart attacks, or the heart disease that we commonly know as. Yes. So heart failure is there are early signs which only your doctor can pick up. See, you have blood pressure, you are taking medicine, it is going on since years. But then there would be certain signs or certain symptoms which your doctor will pick up, like persistent swelling in your legs. You have breathlessness while walking. Initially, you could have walked say up half a kilometer without any distress. Now you have to sit in between. You have to take rest in between. So these are the subtle symptoms of heart failure. You may have certain blood tests can ensure it, like NT-proBNP will help you ascertain whether you are in heart failure. And if you are initially diagnosed with heart failure, you should know what are the risk factors which is causing your heart failure. It is because of your high blood pressure or your diabetes. You have to adequately control it, and you have to take your doctor's advice and manage it properly. The heart failure, as I said, is not a simple disease. It can have severity from say 1 to 100. So each patient cannot have the same treatment going on. Your treatment has to be customized. It has to be according to what are your symptoms, and the doctor will decide what is tailor-made treatment for you. But broad guidelines are to control blood pressure. You can have to moderate your salt intake. You have to moderate your alcohol intake. You have to well control your diabetes. You have to quit smoking completely. You have to moderate your alcohol intake. So salt is like you can have around 5 to 7 grams of salt per day. You have to avoid very high salt things in which we take in our normal diet, like pickles, papad, chutneys, tomato sauce. This and bakery products. This all contains very high sodium content, which can in turn lead to your heart failure or increase your heart failure. Blood pressure and diabetes has to be adequately controlled. Certain medicines which may deteriorate your heart failure can also be taken by your doctor, and he will modify those medications. Initially, first thing is it has to be an early diagnosis. When you diagnose this early, so you can control it very well, and you can survive for years together if you control it and you monitor it better. Monitoring means you have to control your blood pressure, diabetes has to be controlled, you take care of your weight, you need to lose some weight, you have to be very punctual in your routine visits, and to make your heart stronger, moderate exercise after consulting with your doctor, decrease the salt intake. And if you have heart disease, then certain medicines has to be stopped or modified. or you can take a good care of your body by to see nutritional deficiencies and to take your medicines regularly. There are other modalities which are available in future or right now also. The assist devices are there. Other recent medications are also there. And recently in India we have heart transplantation also in cases of heart failure which is not answerable to the routine treatment. Heart transplantation is also a very good modality, but the organs are very limited. So my message is that diagnosis it early and to take care it early, the slow the progression, so you can live a very longer and healthy life.